Hello everyone, my name is Dr. April Speed and welcome to Dr. Speed's Global Breast Health and Wellness Center video blog. I'm really excited to talk about a topic that a lot of patients have inquired about, and that's atypical ductal hyperplasia. Many women that come to see me often will ask, have you had any biopsies in the past? And they'll respond either yes or no. And those that will respond yes, my next question is, what was the diagnosis? Many will respond, well, it was benign. And my immediate response is, well, what type of benign? And most of those patients are unaware of the type of benign breast disease that they were diagnosed with on their breast biopsy. This is important because there are several biopsy results that can put a patient at increased risk for breast cancer later. So it's imperative, viewers, that if you've had a biopsy in the past, not just on your breast, but any biopsy, that you engage your clinician in the conversation as, okay, what does this diagnosis mean for me today, 5 years from now, 10 years from now, and for my lifetime? Because there are certain diagnoses, although they're benign, they can put you at increased risk for breast cancer later. An increase of at least 5 times that of the average woman without a particular diagnosis. For example, atypical ductal hyperplasia, which is the topic of our discussion video today. Atypical ductal hyperplasia is just defined as cells in the ducts of the breast that are growing abnormally fast. So if you break the word down, atypical means not normal. Ductal is just a part of the breast, which is the breast duct. It's a component that helps decompress fluid out of the breast. And hyper means rapid, and plasia, growth. So again, atypical ductal hyperplasia. Now, how is this diagnosis done? Most people will get this diagnosis after having undergone a breast biopsy of either a mass that a woman can either feel or not feel in her breast, or a diagnosis is gotten by a breast biopsy from calcifications on mammogram, which are abnormal minerals in the breast that can put a woman at increased risk for breast cancer if there's a diagnosis of atypia. And sometimes they're even diagnosed on open biopsy, where a patient will go to surgery and have the mass surgically removed. Nonetheless, regardless of the method of diagnosis, the results are the same. Women that have a diagnosis of atypical ductal hyperplasia are at an elevated relative risk for developing breast cancer later, 3 to 5 times that of the average woman without a diagnosis of atypical ductal hyperplasia. Now, one may ask, well, is it the breast that I have the diagnosis in that's at increased risk? And my answer to that is it's both breasts. So it's a marker of future breast malignancy. It's not a breast cancer. Some of the atypical ductal hyperplasia can mimic early stage breast cancer, which we know is ductal carcinoma in situ, or DCIS. But I can't emphasize enough, this is not a breast cancer, but a marker of future breast malignancy. This is really important information for a woman to be empowered with. So you get a diagnosis of atypical ductal hyperplasia, you want to make sure you ask your clinician to elaborate on what your future risks are and what your present risks are. Now, the next question is, how is this disease managed, or how is atypical ductal hyperplasia best approach? The best approach is to lower your risk, but in order to know what the benefit of lowering your risk involves, you really need to engage your clinician in a conversation regarding your family history, if you've had additional biopsies in the past that have shown atypical ductal cells, and also if you have the breast cancer gene, mainly BRCA1 or BRCA2, which I discussed in a previous video blog, and please feel free to watch that segment on what BRCA1 and BRCA2 and what it means to a woman in regards to whether or not they need a double mastectomy. So in terms of the management of atypical ductal cells, the risk lowering can involve medical reduction in your risk by Tamoxifen, which is a medication that is offered by a medical oncologist. The patient will take it every day for 5 years to try to help cut that risk of future breast malignancy in half. Some women that are done with their childbearing years that may want to forego daily medication regimen can opt for a removal of the ovaries by a trained OBGYN. So it's really imperative that you have the discussion with your clinician about what is your risk with your atypical ductal hyperplasia, and to understand that it is an elevated risk and what can be done to lower it definitely depends on each particular patient situation. So I hope this video blog was helpful in terms of adding a little more clarity to a diagnosis that's benign of atypical ductal hyperplasia but has an elevated risk, and things that you can do to be empowered and inspired to lower your risk. Thank you for tuning in, and I'll see you at the next video blog. Please comment and add your questions so that they can be answered on our video blog, and we're just so excited to have you tune in. We'll see you next time.